Welcome back, dear doctors. So for today, we're going to take a quick review about how to read an electrocardiogram. Okay, we are going to see some points and finding out how we can understand this electrocardiogram. Okay, just to remember, we know that this electrocardiogram, which we can known as ECG or EKG, will be a test that will check our heartbeat, how the heart is functioning, and we are going to measure those electrical activity of our heart, going from all the chambers, the atrials and the ventricles, and all the cycle of the bumping of the heart. We must remember that with each heartbeat, these are led by electrical impulses or waves, and we know these electrical pulse will travel through all the heart, and these waves will cause the muscle to squeeze and pump blood from this action. We must remember that we have this sinusoidal node, which is localized on the wall of the right atrium, and it begins with the depolarization in these atrials from the right to the left, and it causes the contraction of the muscle. It begins as we say at the apex, and as a result, the registration on the strip is the QRS complex, and this is after this the atrial repolarization will occur. So at the beginning, the depolarization, of course, as we said, in the four chambers, both atria at the beginning, firstly, and then they go through the ventricles. As we saw, these movements are represented on the electrocardiogram with all those waves. Let's take a look of each one of them. Okay, these electrocardiogram waves will include the P wave, which represents the depolarization of the atria, responding, as we said before, to the sinusoidal node triggering. Then we have the QRS complex, which means or talks about the depolarization of the ventricles, and which triggers the main pumping contractions. We have the T wave, which is the ventricular repolarization, and between those waves we have those intervals. The first one is the PR interval, which talks about the delay of the auriculoventricular node, that it's making or helping or allowing the ventricles to fill again with the circulation. And on the last part of the waves, we have the CT segment, which begins or is showing us the beginning of the repolarization of the ventricles. And this CT segment usually must be totally flat. Okay, so we have different values for those waves and intervals. Talking about the R and R interval, it's we're measuring the distance between those high peaks, and we know that this interval should be 0.6 to 1.2 seconds. When we talk about the P wave, we talk about 80 milliseconds, and when we talk about the PR interval, we know it should be 120 to 200 milliseconds. We also can have this measuring in seconds, as we can see in the low part of the picture. Okay, so what are the steps that we are going to use to read our electrocardiogram? So we have to evaluate the waves and those intervals on the electrocardiogram. So we're going to take a look of these 7 points. It's going to be a quick review. We must include, as we know, the PV weight, the QRS complex, CT segment, the T wave, and the QT interval. Okay, as we know, each one of them will be representing depolarization, repolarization, or the entirely ventricular systole. Okay, first one, to calculate the heart rate. The first one, we must calculate the rate of how the heart is bumping. We have like a different kinds of or ways to calculate the rates. We have the sequence like uh, counting 300, 150, 175, and we have different ways to calculate the rate. Let's take a look of them. The heart's electric system that controls the rate and rhythm of the heartbeat is what we use to determine the heart rate on the electrocardiogram. The atrial rate will be measured by the PV wave, and the ventricle rate will be measured by the rate of the QRS complex. Okay? Just remember, the P wave is the polarization of the atria responding to the sinoatrial node triggering, and the QRS, as we remember, is the depolarization of the ventricles triggering the main pumping contractions. So this is the way we are going to determine the heart rate on the electrocardiogram. If our patient has a regular heart rhythm, then we may use this method. We count the large squares between the RR interval, and then like in this example, we have 4 large squares in this R and R interval. So we just divide 304, and then the heart rate will be 75 beats per minute. If our patient has not a rhythm or a regular rhythm because the R&R intervals are very differently, then we must consider another option, which be counting the number of complexes on the rhythm strip, the total rhythm strip, and then multiplying the number of complexes by 6, because this will give us the average number in 1 minute. If, as an example, have 10 complexes on this rhythm strip, then we just multiply by 6, and then our heart rate will be 60 beats per minute. Okay, and then let's see, what is the normal adult heart rate? Well, as we know, we must have a physiologic rate, which is the normal one. As we can see, we consider 60 to 100 beats per minute as a normal heartbeat. And we have those another abnormal heart rate, which would be less than 60 beats per minute, which we call bradycardia. And when we talk about more than 100 beats per minute, we talk about tachycardia. And we must also consider that the younger the person is, the beats per minute will be higher. As we know, up to 1 year, those newborns or babies will have the range from 100 to 160 beats per minute. If this child is 1 to 10 years, we consider 60 to 140 beats per minute. That is totally on the physiologic rate. When these children are on the teenagers, about 10 years, and adults, we consider 60 to 100 beats per minute. And there's a special condition for those athletes that will have a range from 40 to 60 beats per minute. But as we are taking care of patients, we should be aware if they are athletes or they have sport activities. So we consider it's normal to have these low numbers for the heart beat. Okay, The second part talks about the heart rhythm analysis. As we know, the electrocardiogram can reveal those disturbances in the heart rhythm or detect those abnormal electrical patterns. On the left side, on the right side, we can see the normal heart rhythm. We can see how the it's very regular. We can see all the traces in there, and on the right side, on the left side of the chart, we can see how this rhythm can be so irregular, like having different kinds of traces. Let's take a look of each one of them. We must, at the beginning, when we are analyzing this heart rhythm, check if these QRS complexes as rhythm. If the R&R intervals, which are the distance between two QRS, are similar. And then we must be counting if the distance is the same, and then we can find out if a rhythm is regular or irregular. Okay? Because we have these two options. A normal heart rhythm which goes all the time at the same, just like a song, okay? It's always the time, it's always the time, always the time, at the same time, okay? The same intensity. And when we talk about those irregular heart rhythms, we have all these options. We talk about tachycardia, which is meaning that the heartbeat is going like too fast. Bradycardia, when it's going like too slow. We can have this extrasystole, which is an electric shot in the middle of the heartbeat. We might have this atrial fibrillation, which has no P waves. Auricular flutter, which also is like irregular, and the ventricular flutter, what means like no activity or a very irregular activity of the contracting muscles in the heart. And as we can see, we have a lot of different abnormal rhythms. Let's just remember that we have this classification. First of all, we have regular or irregular, which is the main classification. And when we talk about those irregular heart rhythms, we know we can be regularly irregular and then irregularly irregular. Let's take a look so we can understand a little bit more. Okay? When we talk about this regularly irregular, it means they are irregular, but somehow they have a recurrent pattern of the irregularity. As we can see in the first picture, we have a long a long QRS picture, and then we have a long one, a short one, and a long one, and a short one, long one, short one, long one, and so on. It means it has a pattern that it's recurrent, even though it is irregular. Okay. On the second picture, this is a totally mass. As we can see, this is irregularly and it's totally irregular. Okay. So we can see that we have like the short ones, and then we have long ones, and then we have a very long ones, and or very short. So there's no any regularization in this strip. Okay. Some examples of these irregular signs of in electrocardiograms. It's the atrial fibrillation. Okay, let's go to number 3, talking about the sinus rhythms. We know that, as we heard at the beginning, the sinoatrial node on the wall on the right atrium will start the depolarization in the right and left atria, and it causes the contraction of the muscle. So this is the sinus rhythm when the sinoatrial node is the pacemaker. Okay, as we can see, because it's the one that will impulse the contract of the heart. Okay, it's autonomous, and it's as we said, located at the right atrium, and it will be going from the right atrium to the left atrium and then to the ventricles. But the pacemaker will be the sinus atrial node. Okay. When we talk about the sinus rhythm, we must be sure that the P wave will be always followed by the QRS complex. As we can see, on this electrocardiogram strip, we can see all the time there is a P, 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 and well, in the right part, then maybe it's lost. Okay, but there's the condition, it's that the P wave should be always followed by the QRS complex. And then we must be taking a look of the P waves. We must be sure they are present, and we must be sure that the P wave is followed by the QR complex. If they are looking normal, we must consider the duration, direction, and shape of the P waves. To consider, we have a sinus rhythm. Okay, if we have a P wave is absent, then we should know if there is any atrial activity, because we can have those different situations like sawtooth baseline. When we have flutter waves, we can see how it's like a saw. Okay, if we have a chaotic baseline, we know that we have those waves that are fibrillating, and when there's no atrial activity at all, we will find a flat line. Okay. Okay, continuing with the examination of the electrocardiogram, we know that we should review this PR interval, which is the flat line between the end of the P wave and when it starts the QRS complex. Okay, these PR intervals will represent the conduction time from the atrium and the ventricle, and is going to be controlled by the atrioventricular node. And as we know, if we have some prolonged PR interval, we will be talking about a first degree AB block. Or if we have a very, very short PR interval, then we may be talking about some other diseases. Okay, the PR interval normal duration is 0.12 seconds and 0.20 seconds, and as we said, we should measure the beginning of the P wave and the beginning the QRS sign. Okay. Okay. As we said, if we have a prolongation of the PR interval, we can diagnose a first degree AB block because it is taking too long. Or if this PR interval is too short, then we can diagnose a Wolff-Parkinson-White syndrome. Okay, the number 5 is the assessment of the QT interval. As we know, this interval should be measured from the beginning of the QRS complex until the end of the T wave. It will all this QT interval. It's depending all the time on the heart rate. So this value, his value or its value, should be corrected according to the heart rate. We have to take an account this situation. The corrected QT interval, it's normal if it is between 350 and 450 minutes. Okay. And also we can have like some difference if we are males or females. Number 6, we talk about the electrical axis, and as we know, we must determine if the QRS complex of the leads 1 and ABF are positive. They should be positive, so it is a correct position for the heart. And we know that this cardiac axis will describe the overall direction of the electrical spread within the heart. As we know, in a healthy individual, the axis should spread from 11 o'clock to 5 o'clock, considering it should be positive. As we know, when in lead 2, the most positive deflection it's has present in this lead 2, and we know, as we have been talking about before, the sinus rhythm it's the one that will start the contraction, and if this sinus rhythm, this senior atrial node is the pacemaker, then the mean direction of the atrial depolarization, it means this p-wave axis will be pointing downwards and to the left. Remember, it started to the right part, then it has to go to the left, down and left. So the PV wave will be always positive in this lead 2. But on the contrary, when we talk about the lead ABR, it will be always negative. When we have these conditions, then this indicates that the P wave it's normal. It's its axis is normal, and the rhythm will be a sinus rhythm. Finally, when we talk about the ST segment alterations, we know that this segment is the line that starts at the end of the QRS complex and at the beginning of the T wave. This line should be isoelectric, and we must really be sure if it is lowered or elevated. Because of course, if we have these conditions, it's talking about a very serious condition. As we know, this is the region between the end of the ventricular depolarization and the beginning of a ventricular repolarization. So in this part is when we can find out if we have some acute myocardial infarction. As we can see, the anterior ST segment elevation and inferior XT segment elevation. In this part, it is obvious that we are having like a myocardial infarction. Okay, doctors, it's just a quick review, and take a look of the video anytime you want, and then we'll see you at the Zoom to talk about these electrocardiogram waves and segments. Bye bye.